Welcome to a special edition of This is Public Health, a podcast from the Illinois Department of Public Health. This edition kicks off our annual observance at IDPH, 30 Days of Public Health. And who could be more appropriate to join us for this discussion than the director of the Illinois Department of Public Health, Dr. Vohra. Director, as always, thank you for taking the time.
Thanks so much, Jim.
Well, this is the second year in a row that IDPH has declared 30 Days of Public Health and launched a month-long celebration of public health professionals in the work that they do. Why the big push?
It's just, I think, incredibly important for us to celebrate all we do in public health and the public health heroes across Illinois that are working every day to combat infectious disease, promote healthy behaviors, work on chronic diseases like heart disease and cancer, keeping our water safe and inspecting our food. Just the gamut of all of the things that happen in public health systems across Illinois. We also know that this is a complicated and challenging time for our public health professionals, and we are seeing incredible changes on the federal level. And so as we combat those things together, it's also an important moment to celebrate all that is good in public health here in our big, diverse, incredible state.
You know, it's one of the great ironies of public health that people don't really notice it if it's being done right. Nobody stops to consider the disease outbreaks that didn't happen or the cases of cancer or heart disease that someone didn't get. So how, in your view, does that affect the public's perception of public health?
Well, it's hard to really understand when you don't notice the things that are happening. But what I like to think of us, public health is a shield that protects you and your family now and prepares you for the things of tomorrow. I and the public health professionals here in the Illinois Department of Public Health, our local public health professionals, what they're really doing is that they're taking on that responsibility to protect and promote our health so that we don't have to think about it. And I know that I and our public servants in the state and the local communities, we are happy and honored to take that responsibility so our residents can do the important things that make them happy and fulfilled.
So what are examples of the types of events and activities that are happening to celebrate this 30 Days of Public Health?
So we have kind of a few different exciting things to talk about. First, we're promoting and blasting out this idea that it's 30 days of public health. But there is part of this, we do it in April because April and this year, April 7th to the 13th, is National Public Health Week. And there will be a variety of different programs and things going on at a national level during that time. It's also a moment during the year where we also celebrate specific other activities and endeavors, including National Minority Health Month, which also coincides in April. So that's some of the national things that we're incorporating into 30 Days of Public Health here in Illinois. But we're also kind of doing things that are Illinois focused and IDPH focused. We're going to host a job fair in Springfield on April 23rd. This will highlight great opportunities for individuals who want to work on and be a part of the public health community. We'll also have the centerpiece of the month for us is the 2025 Illinois Infectious Disease Conference, which will be in Champaign on April 15th and 16th. We'll have speakers from Memorial Sloan Kettering Cancer Center in New York. We'll have the president of the Association of Professionals in Infection Control and Epidemiology, and other incredible speakers that are really trying to talk about the latest issues in infectious disease. And we're going to continue our other modes of communication, our social media. We're going to amplify stories of public health professionals. And we're going to have this podcast, as well as one later in the month, talking about local public health transformation.
We'll have also a special webpage at the IDPH website for 30 Days of Public Health at dph.illinois.gov. You'll see more of all of this and a special video message from Governor J.B. Pritzker as well, also acknowledging the important work of public health professionals. You're listening to This is Public Health with the Illinois Department of Public Health. Our guest, Dr. Samir Vohra, the director of the department. And Director, you mentioned that job fair that's coming up in Springfield, and I know you have talked a lot about careers in public health as we focus on the professionals who keep Illinois safe and healthy. Why is this a field that someone should consider, and who is a good fit for working in public health?
Jim, I always like to say that there's no kind of wrong door into public health. Of course, we have incredible programs, School of Public Health at University of Illinois at Chicago, where you're learning all kinds of interesting things about public health policy, epidemiology, but there are opportunities in our world for all kinds of different uh, professionals and different individuals just being interested. From uh, aspects in our world around food, water, maternal and infant health, preparedness and response. We have individuals with all kinds of diverse backgrounds interested in social work, law, public policy, communications. Also, there are incredible core functions like our finance, HR, things that really make the engine of public health go. So, if you have a passion for public service, if you want to make the health of your loved ones and communities better, there's no wrong door to join public health and make an impact in your local community and for the state of Illinois.
Again, more details on that job fair can be found at dph.illinois.gov. Director, you mentioned earlier some of the news coming out of Washington. We've had reports in recent days of funding cuts, job cuts at the Department of Health and Human Services. We've had the reporting earlier of plans for the U.S. to withdraw from the World Health Organization. How are these moves impacting the work being done by IDPH and its partners?
It is a complicated time in public health, and we're seeing massive changes come on the federal level, and we're working to assess and monitor those changes at a rapid clip and working with our partners in the local health departments to understand what is being affected, what we can put into place to help mitigate those changes. But the reality is that there's only so much one state can do to combat these federal challenges. 65% of our last fiscal year 25's budget for the Illinois Department of Public Health was coming from the federal government. So federal funds were responsible for 65% of our IDPH budget. But I can say two things. One, our commitment to our residents to do everything and use every available resource to protect their health is absolutely at the forefront. And we are going to continue to work, grow our partnerships, and ensure for our residents in Illinois that credible information that's up to date based on the latest evidence will be presented on our IDPH platforms so that all of you listening can ensure that you have the most accurate, credible information to make the decisions for the health of you and your family.
We're talking about the 30 Days of Public Health celebration of public health and the people that make it happen here in Illinois. And Director, you mentioned a couple of the events that are coinciding with this observance. I want to talk a little bit more about each of those, starting again with that infectious diseases conference coming up in April in Champaign-Urbana. Talk a bit more about the importance of this conference.
It is one of our signature conferences at the Illinois Department of Public Health, and we've been very excited that it had to take a pause during the height of the COVID-19 pandemic, but now it's back, and it allows us to bring forward important, critical conversations around the state of infectious disease prevention in the state of Illinois. It allows us to bring in national experts that are talking about how we track infectious disease, how we foster new and unique collaborations, how we think about promoting vaccines at a time where we know the education about their importance is that much more critical. And it allows us to work together on communicating complicated topics so that we can bring those back to our communities and we can create tighter bonds of collaboration and partnership that keeps our state healthy. So 2 days, April 15th and 16th in Champaign, a real incredible conference. There's still time to register, so please do, and look forward to all the learnings and all the partnerships to come at the conference later this month.
As was noted earlier, April is also National Minority Health Month, and Black Maternal Health Week falls during the month of April as well. Talk, if you would, about those observances and how they tie into IDPH's mission toward health equity.
Health equity continues to be a incredibly important aspect of our work. And at the core, it is public health, trying to understand why certain populations are healthier or unhealthier than others, and using that information to create the strategies, programs, policies that give us all the right foundation and opportunity to be as healthy as possible. Health disparities and our work to address them continue to be core to our mission. And it is something that we are very fortunate here in Illinois, led by Governor Pritzker, who's working to eliminate long-standing disparities in health, especially around maternal health and the governor's ongoing birth equity initiative, bringing together different state agencies as we work together to understand the challenge. And in Illinois, a Black mother is 3 times more likely to die from a pregnancy-related medical condition than a white mother. Understanding those gaps, creating plans and strategies to close this disparity, because and it is the goal here in Illinois, for it to be the healthiest state to have a child, and we'll continue our hard work to get there.
Many activities and events as part of the 30 Days of Public Health. We'd like to remind our listeners you can follow along for all this information related to 30 Days of Public Health and the work that we do here at IDPH. We'll have a special 30 Days webpage at our website, dph.illinois.gov. You can also follow IDPH on all major social media channels, including Facebook, X, Instagram, LinkedIn, and Blue Sky. I want to once again thank our guest, IDPH Director Dr. Samir Vohra, for joining us. Please be with us next time for another edition of This is Public Health with the Illinois Department of Public Health.